We'll start by talking about what is journaling. I think it's something that everybody knows what it is. Perhaps most have had firsthand experience with journaling, but let's try to define it. Then we'll look at the research literature and see, well, what does research say about journaling? What research has been done on journaling and any benefits of journaling? Then I'm going to present to you what I call positive peer journaling. This is a form of journaling that I came up with, invented, that is designed to support addiction recovery. I'm going to show it to you, tell you all about it, and tell you the results of 2 studies I've conducted on it. We'll close with some final thoughts and clinical recommendations about journaling to support addiction recovery. So what is journaling? In the chat, if you'd be willing, go ahead and type in, it doesn't have to be right or perfect, but type in, what would you say journaling is in your own words? You know, when you think of journaling, how would you define it? If I were with you live, I'd ask you that and we'd hear from you. A reflection of goals. Okay, great. So journaling is a place to think about the future. Writing down your thoughts, a reflection of thoughts. Documenting your process, something to look back and read. Processing your thoughts and feelings, an outlet for feelings, an outlet for emotional expression. Very good. And meditative thoughts, depending on the type of journal, it might change. Very good. Stream of consciousness, absolutely. Well, you might be interested to know that there's no one definition of journaling in the research literature. I think most of us would think of journaling, as people have said in the chat, as a book that you open that's pretty much blank and empty, where you do some free form writing. And there's some qualities to it that we might all agree are present. One, as many said, is emotional expression. You're brimming with emotion and you get it out on the page. And another might be that the idea that your journal is safe. It's a safe space to express yourself, safe from the eyes of others, the thoughts and feedback of others, or the judgment or criticism of others. Let's start with poll 1, 2, and 3. Let's jump right into a poll, Joe. Okay, so the poll questions are, there's 3 of them all at once. I have a regular journaling practice now, yes or no. These are for you to fill out. I have a regular journaling practice in the past, or I've heard of these journaling approaches, and you can click as many as you, multiple choice, you can click as many as you want. Bullet journal, monk manual, or morning pages. So we'll give people a bit of time. Okay, let's close the polling. And what we've got is 18% of those viewing have a journaling practice now. 52% have had one in the past. And most people have heard of bullet journaling, 75%, with only 4 people hearing of monk manual and 40% hearing of morning pages. Excellent, thank you for that. Okay, see, I can now share the results with you. Okay, got it. Stop sharing results. Okay. So one that you might want, there's all kinds of journaling out there in the lay public, out in your books, your local bookstore, forms of journaling that are accessible to people. I just want to go over some of them, to me, the most popular ones. One is bullet journaling, which has an aspect of self-expression, but also is kind of like a time management or a way to get things done, a productivity system. There's also something called a monk manual that is quite heavily being advertised. By the way, I should have mentioned I have no conflicts of interest. I don't endorse any products. I might mention some things, but I'm not on anybody's payroll in terms of endorsements or anything. So a monk manual asks people to reflect on thoughts and feelings with written prompts. And you might have heard of Julia Cameron's morning pages. Julia Cameron is an author of a book called The Artist's Way. And she says everyone should start the day by writing freehand for 3 whole pages, stream of consciousness, And that's the best way to connect with creativity. So those are three types of journaling out there in the public, in the lay public, on your bookshelves, in the bookstore. Joe, let's launch poll 4 and 5 and move into clinical ideas about journaling. Number 1, I have recommended journaling to a client. Number 2, if I have recommended journaling, I've also recommended a specific approach. Give people about 10 more seconds. Okay, great. Thank you. Let me share the results. I have recommended journaling to a client. 83% have said yes. If I've recommended journaling, I also recommended a specific approach. 53% have said no. 31% have said sometimes yes, sometimes no. So a thought I have is that recommending journaling is in some ways like recommending a gratitude practice. It's very commonly recommended, but we don't really have that much research to guide clinicians on how to tell their clients what would be the best approach to doing a gratitude list or to doing journaling. In some ways, both of those tasks are things that people intuitively know what you mean by that, and I'm just a little distracted by the polling. I don't think you can see it anymore. Is that right, Joe?
Yep. We stopped the results, so you're good, Amy.
So the journaling and a gratitude list is a recommendation, but how can we optimize those recommendations so people get the most out of them? What has the research literature said about journaling? All right, let's go to another poll number 6. Researchers have said that journaling can improve health because of which of the following? Select as many as you like. Reconstruct the meaning of past events, manage, control negative emotions, further self-expression and understanding, help uncover positive aspects of negative situations. Give you about 10 more seconds. All right. So everyone endorsed all 4 of these at very high levels, and they're all 4 true. So research has said that all 4 of these are the ways that journaling can improve health. 2 types of journaling have been studied in some depth in the research literature, and I might say only 2 types. The first type is called expressive writing, and the second type is called interactive journaling. And interestingly enough, neither of these really map to how we all would define journaling. Expressive writing, okay, is one of the ones that's had the most research on it. And the theory behind expressive writing is that holding in emotions related to past negative events is stressful, and this stress is bad for our health. If we talk about these emotions, it's helpful, but this line of research has shown if we write about these emotions, it's also helpful. So a typical expressive writing instruction to research participants is really to get at very, very troubling and painful memories and emotions. The instructions would be to write about your deepest emotions and thoughts about the most traumatic experience in your life. They would have people respond to that prompt every day, writing for 15 to 20 minutes from 3 to 5 days in a row. Then they would look at the impact of that exercise on a range of outcomes. The results have been that people initially feel worse. So right away after writing, they will feel worse. But over time, they show improvement in physical health. The idea being that that act of expression relieved them of something, and they were healthier as a result. There have only been 3 studies of expressive writing in the field of addiction, and the most robust one was a randomized control trial, 149 women in residential treatment. They did the exercise that I explained about writing about the most painful emotions related to a traumatic incident And 2 weeks later, they had fewer mental health symptoms than the control group, but at 4 weeks, there was no lasting benefit. Then there was a couple of very small studies. So one study of 22 men who have sex with men who were HIV positive and used methamphetamines. They used an expressive writing component, and their results were mixed. At 1 month, the control group, at 1 month, the treatment group looked better off, but at 2 months, the control group looked better off. So both studies so far are suggesting not a lasting benefit. Then finally, there was a final study. It was a single group study, no control group, 48 people, but only 14 were retained in the study at the 2-week follow-up, and that showed no impact, but that study had some methodological limitations, like a lot of people dropped out. So what are the takeaways from expressive writing and addiction? There have been very few studies, but across these few studies, participants all said they liked the writing exercises. They were enthusiastic about participation. They felt that the writing exercise was helpful to them, and they'd recommend expressive writing to others. The second kind of journaling that I'll talk about next that has received the most focus or attention in the research literature is something called interactive journaling. Now, interactive journaling is delivered by way of a booklet, and the right-hand image you see, Responsible Decisions, Impaired Driving Program. This is a booklet. It kind of has the size, shape, and heft of a magazine, like a colorful, glossy magazine. This magazine, called an interactive journaling, was used for people who got a driving while under the influence conviction. Now, if you open up these booklets, what you find is there's some very compelling graphics. They're very colorful. They're very engaging. There'll be a little bit of didactic content in them and an opportunity for participants to write their answers right into the booklet based on prompts. So let's take a close look at just a random page from that booklet, from that interactive journaling intervention for people who've been convicted of driving under the influence. This page on the left-hand side, for example, explains all about BAC, blood alcohol content, and the degrees to which the person's blood still has alcohol in it over many, many hours after a drinking episode. So it sort of has that educational piece. Then at the bottom, the person gets a prompt that they respond to. Do you think you have ever gone to bed with a BAC of at least 2.0? Yes or no? If so, explain. And the person writes in their response to the prompt. So there's a little bit of learning and direct ability to respond in writing. So what about research on interactive journaling and addiction? Well, the DUI study showed that when people did this booklet, they filled out this magazine, it improved their knowledge about alcohol, and it improved their willingness to change. Now, in a different study of people who were incarcerated, who had substance use disorders, interactive journaling reduced rates of criminal recidivism. So some benefit for the initiation of behavior change, not necessarily the maintenance of behavior change, but interactive journaling has shown to have an impact on initiating behavior change. So what are some of the limitations to the existing research on journaling that I've just presented? Well, expressive writing has focused primarily on negative events and trauma, and there have been few studies on addiction. Well, what about if we had a journaling practice that would intentionally focus on what is going right with recovery? And interactive journaling has focused primarily on the initiation of behavior change versus the maintenance of behavior change, which is arguably harder. As hard as it is to start or initiate a behavior change, it's arguably harder to maintain that change over time. So what if we had a journaling practice that focused on the maintenance of recovery once someone has already initiated recovery? So here we are leading up to the rationale that led me to create positive peer journaling, which is a journaling practice that supports the positive elements of, and therefore the maintenance of recovery. So the reason for the need for this is that in early recovery, individuals with addiction are really beset by negative emotion, and that's largely from psychosocial reasons and also from physiological reasons having to do with what happens to the brain after a career of addiction. Individuals in early recovery are facing their negative social and environmental consequences of their addictive behavior, which causes negative emotion. And then changes in the brain that occur as the result of addiction work to suppress positive emotion in response to normal, pleasant activities and pleasant aspects of life. The person can't feel good about them. They don't feel anything, but they do feel an increase in stress. And those things persist into early recovery. Also, there are general psychological principles that apply to all people. And these principles say that we react more stridently to negative emotions. They grab our attention in a brighter way than neutral or positive emotions. They stick in our minds. We ruminate about them more. They last in our mental sphere longer than positive emotions. So all these three things taken together bundle up to a lot of negative emotion in early recovery. These negative emotions have been strongly associated with relapse, and they can contribute to the perception that life in recovery is painful and difficult. So therefore, why bother? Why bother with all the hard work of staying sober if life feels bad? So in my work, I use reinforcement theory. Reinforcement theory basically says if something feels good, we'll do more of it. And reinforcement theory has been applied to why people use substances to begin with. But reinforcement theory can also be applied to recovery with the idea that if recovery becomes more reinforcing, more pleasant, more positive, more enjoyable, then life in active addiction, people will do the hard work needed to maintain recovery. So if an intervention can reduce negative emotion and help people feel better about life in recovery, this could encourage relapse. It could encourage people to stay sober one more day and might contribute to lower rates of relapse. This idea motivated me to develop and test positive peer journaling. So let me go ahead and introduce you to this intervention now. So what is positive peer journaling? Well, first of all, it's tailored for people who are in recovery from addiction, but arguably it's useful for anyone. It's a journaling practice. It has some elements from positive psychology. It promotes thriving, flourishing, wellness, and the good life. The positive psychology element is meant to create a feeling of good, positive emotion. It has elements of behavioral activation, which means it has elements that encourage people to take meaningful steps toward their values and things that are important to them in their lives in recovery, and helps them nudge toward taking that first step toward what they really want for themselves. So it bundles together these two ideas that haven't been combined before. It also has some elements from 12-step community practices. It in some ways represents a 10th step inventory because it involves the review of the past day. And some 12-step programs have an action plan. So this has the element of an action plan. What I've done with PPJ is I teach it in a group setting first. So in over 8 one-hour sessions, I teach it to a group. And then by that time, people know how to do it on their own, and they then continue to do it on their own. This is what a main PPJ journaling page looks like. In publishing, they call this a double page spread. And what that means is it's the left-hand side of the page and the right-hand side of the page open up with a spine in the middle. And on the left-hand side of the page, people review the past 24 hours. On the right-hand side of the page, they plan the upcoming 24 hours. The left-hand side of the page mostly has the positive psychology stuff, and the right-hand side of the page mostly has the behavioral activation stuff. So on the left-hand side of the page, they do a gratitude practice, which is called the good things exercise. They make a list of as many good things that happened in the past day that they could possibly think of. And they want to make that list as long as possible. Then they write what we would consider a standard gratitude list. all the things the person can think of that they're grateful for. And these two things are overlapping, but they're actually distinct. So it's two pathways toward accessing good things that are happening now in recovery, two roads in to that material instead of just one or the other. We also have a space for them to record the bad things that happened over the past day. And there's a couple of reasons for that. One is that it just wouldn't reflect a real life at all if there was no bad things. It would just be rose-colored lenses if we didn't have a place for people to record the inevitable things that happen in a day that get on our nerves, upset us, or bother us. That's just the reality of life and the reality of recovery. Plus, if they have a bad things list, it could have that expressive emotion impact. It could allow people to pour out things that are pressing on their heart and have an outlet, like with the expressive writing, to get it out and get some relief that way. Then we move into another positive psychology intervention called acts of kindness. Our list here in PPJ is called Good Wishes for Others, where people are asked to think about other people who are suffering right now, maybe because they've just had surgery, or they're elderly, or they are worried about something, they have a concern. A place to send good wishes out to people we know who are suffering and the people we love, and make a list of those people, and then agree to reach out to one of those people today and say to them, how are you? I'm thinking of you, which we hope would forge and improve some social connections. So what's happening on the right-hand page? We have several categories, and the right-hand page is basically a to-do list, except it's a little bit of an enhanced to-do list because it includes some other elements. So they would make a list, a bullet pointed list. So all of these entries only require a bullet pointed list, no long paragraphs or sentences. So spelling doesn't matter, handwriting doesn't matter, grammar doesn't matter. It's just getting out bullet pointed lists. So they would make a list of things they have to do in the coming day or would like to do related to work and education, home and housing, joy, so to plan at least one joyful thing for oneself every single day. Things they want to do for health, recovery, spirituality, their community, social, financial, and we have a spot for amends and repair so that this can approximate a 10th step if someone wants to review the past day with an eye toward amends and repair if they feel they want to do that and are ready for it. And 2 spaces for the person to write in whatever category they want, maybe a short-term goal like a trip they're planning or run their first 5K. They might want to have specific goals around something to do with maybe creative endeavors. We also have written prompts that give people ideas for what to write down. So in a study I did several years ago, 2014, we did just the good things intervention alone. And some people in recovery from addiction, they didn't know what we meant by good things. And we asked them to come up with 3. And some people could not think of 3. They could only think of 1 or 2. So we realized in this study, we needed to give people lots of suggestions and model what we meant by that. So people had an abundance of ideas, and they were very, very able to write 6 to 8 good things very, very easily. With these flaps that come out that are surrounded by red. These are suggestions for what people can put if they are unsure what to write. Now, this is a filled out PPJ entry. I'll let you read the entries. What this is, it's a composite of many different people in our research studies, what they have really said. It's nobody's handwriting except mine, my handwriting, and it's a composite. Let me just give you like maybe 20 seconds of silence so you can read this over. This shows a couple of things. People also put good wishes for large groups of people, like all who are homeless, or things we've heard in the news that upset us. And we want to send good wishes to those friends and family of the collapsed building in Florida. And also the amount of writing on this example approximates the average amount of writing that people did in our studies in their PPJ journals. So it's time for another poll, poll number 7. Okay, what kinds of recovery behaviors should PPJ, positive peer journaling, this journaling practice I explained, what sort of recovery behaviors should this journal get people to do, would you say? We'll give you a few seconds. All right, so I'm going to end the polling and show you what it said. So the journaling practice should actually do all 4 of these things. It should help people conduct a review of the past day by looking on the left-hand page and doing those bullet points under those headings. By making the list on the right-hand page, I'll be telling you about our results. It did help people to feel that they could get things done because it was served as a simple planner and it helped them remember to get things done. Taking an action to support recovery in the coming day, absolutely. And noticing all that's going right, absolutely. That came from the gratitude list. There were other things too that you could say that PPJ would have encourage or really almost make or have people do, and that is thinking of others and wishing them well, making a gratitude list, reaching out to others, making a list of things to do in the coming day, planning to do something joyful in the current day, in addition to what you had checked off. So the journal looks like this. We just have them Xeroxed at our local university copy center with the spiral binding. It has about 60 of those double page PPJ entries. It has 12 pages for what we call the important life areas exercise. It has 1 page for the each one teach one script, which helps people cement their learning of PPJ, and 2 bookmarks with suggestions. Those are those boxes in red I showed you on the previous slide. Now, if you would like me to email you a document that has instructions for how to fill out PPJ and a blank journaling page you can Xerox, email me. And my email is at the bottom. I'll make sure you have it. I'll also be very curious if you might be interested in joining me as a partner in my next research study. If that's of interest to you, I'm going to put this opportunity up at the end of the presentation as well, and I'll be able to tell you more about next steps for PPJ at the end of the presentation. So I'm now going to present to you results, or these are both, I have to emphasize, preliminary results of 2 studies I've conducted. The first study is a single group study. That means all the people in the study got the intervention. They all learned PPJ. There was no control group. This was the first study just to see if people liked PPJ and if they could do it. The second study, we just finished data collection in March. Actually, I think it was as recent as May. This was a randomized experiment. We had 82 people, and they either got PPJ or half the group was a control group. They didn't get PPJ, and we could see if there's any differences between the groups. So both groups use the same theoretical framework. That is that we hope, we plan, I hypothesize that positive peer journaling would have a positive impact on treatment outcomes. Everyone in both of these studies was in treatment of one kind or another, either residential or outpatient intensive. We would hope that by treatment outcomes, we mean abstinence, and we mean that they stayed in treatment and didn't drop out. We would hope PPJ would improve their view of life in recovery, help them move toward meaningful goals in recovery, and then therefore stay in recovery. And the idea of this theory, this theoretical model, is built on this idea that PPJ would improve well-being, and I'll tell you how we define that, and that an improvement in well-being in life in recovery would enhance treatment outcomes. This is the basic theoretical model for both studies. What did we mean by well-being in the first study? We tested all kinds of things that we thought would support recovery and have been in the previous research literature about being supportive of recovery. Things like mood, positive and negative affect, feeling optimistic, being satisfied with life in recovery, a general feeling of well-being, gratitude, feeling like you're getting rewarded from the environment, And some of these are negatively valenced, like craving or depression or demoralization. Some are positively valenced, like feeling happy with recovery, commitment to sobriety, confidence staying sober, having recovery capital or resources in the environment that help people stay sober, and depression and anxiety and stress as well. So what were the sample characteristics for both studies? It's interesting to line these up side by side. So these are the demographic and social characteristics. The middle column is our single group study that was conducted in 2019 with 15 women. And the far right column is the randomized experiment, 82 people randomized to treatment, PPJ, or control that we're just finished with. We conducted this study during COVID. So in our first study, all of the participants identified as women. As in the second study, 52% identified as women. We recruited men also and others in the randomized experiment. In terms of age, they were approximately the same age between the two studies. The single group study was slightly more diverse. The single group study was slightly more likely to have a household income last year of less than $15,000. Years of education were similar. Many more in our single group study disclosed that they had a legal issue currently. But in both groups, the level of trauma, having experienced trauma, was very, very high. Nearly everyone endorsed that they had experienced at least one form of traumatic experience. Here are the clinical characteristics comparing the two studies. The substance people were most addicted to in the first study, it was amphetamines. In the second study, it was alcohol. Length of sobriety in days was 48 on average, 48 days sober at when we first met them in the first study. In the second study, 140 days of sobriety when we first met them. That makes sense because the first study, I haven't mentioned this yet, was all people in residential. And the second study was mostly people in intensive outpatient. So it makes sense that they would have longer length of sobriety. Many of them would have been in residential first and then moved to intensive outpatient. Not true of everyone, but many would. That would suggest a longer length of sobriety when we met them. Both had the same number of previous treatment episodes for addiction. So, maybe I'll just take a quick second, Joe, and answer any let me answer a couple of questions, just because this is a lot of information. Joe, go ahead and maybe pull if there's any questions available.
Sure. Lisa had a question early on and asks, has there been any research comparing handwriting versus typing? Is it important for journaling to be done by hand? Any findings there, Amy?
I haven't seen anything about that in the literature. I think many would anecdotally say that there's something different about writing with the pen. Younger and younger people, of course, much more computer oriented and IT oriented. My personal inclination is that there's something feels good about writing. And so PPJ is an analog intervention. It's handwritten, it's not an app, and I like the vibe of it, the way it feels when I do a PPJ entry by hand. Thank you for that question, but nothing that I know of any research on that. What a good research topic that would be. Anybody else?
Thank you, Amy. Florence asked, how can researchers assess whether someone is actually sober when being reevaluated? If you didn't touch on that already, I'm sorry.
Well, in my study, because this journaling is emphasizing what's going right in recovery, we do something a little different than other addiction treatment interventions. And let me say, this journaling is meant to be adjunctive to regular addiction treatment. So it's not meant to stand alone as an addiction treatment all by itself. But because people have then these other places to go with their problems, with their concerns, with their crises, with their relapse, we actually don't talk about that in the PPJ journaling group. So people don't identify themselves by their substance of choice. They don't identify themselves by length of recovery in PPJ groups. They don't disclose any relapse. And in fact, when we read out, because in the groups, we journal together and we read out what we have written, which is very powerful to hear what people have written, we don't tend to share what we write in the bad things that happened column. And that helps keep the group on the focus of what's going well in recovery. So we personally, in our research, we don't track substance use, except we have permission from all the participants that we get that information after the study is over from their treatment record. And the treatment center keeps track of that for us. All right, Joe, I think I'll continue on, but we'll have time for more questions in a bit.
Great, we have more, so please continue.
So the single group study design, and I see we are, I'll try to speed things up a little bit. This involved only the 15 people. They were in the 8-session group with me. Then they practiced PPJ on their own for 2 weeks. Then we interviewed them to ask them what it was like to be in the study. And a study that's small like this with no control group, when there's no control group, you can't say that journaling that the intervention caused was the causal agent of any outcomes. You can just do correlation, like while they were doing the journaling, did they improve in certain areas? You could also look at feasibility, can they do it, and acceptability, did they like it? So what are the results? People attended an average of 6 of the 8 group sessions. The 15 people completed 196 entries, about 14 per person. And the total number of bullets that they put on a given page was 41 bullet entries. People found PPJ to be highly easy, not that difficult, highly satisfying, pleasant, helpful, and they put in a fair amount of effort on a scale of 0 to 10. 10 people completed the study, and that meant they attended at least half the group sessions and participated in the independent practice phase and completed the exit interview. 73% of all participants and 80% of completers did not use substances. 73% of all participants and 90% of completers left treatment on good terms. So what was the impact of these measures of well-being that we cared about? Well, everything you see in red showed significant increases. So over the month that they did PPJ, 2 weeks with me and 2 weeks on their own, we saw significant improvement. So if the needle moved in a favorable direction, it increased satisfaction with life, increased well-being, increased reward from the environment, increased feelings of being happy with recovery, increased confidence staying sober, decreases in depression, demoralization, and craving. This just is a graph that shows with the x-axis being time and the y-axis as an example. In general, I'm happy with my recovery, and that trend line showing that over the time in the study, that increased. They felt more and more happy with recovery, which is what I would hypothesize they would feel after doing the journaling every day. What about qualitative research based on the results? People who did PPJ and had experience with other kinds of journaling thought PPJ was easier, less time consuming, more structured, and recovery oriented. Some things they noticed, and this was true in the experimental study as well, they noticed more good things than bad things were happening in a day. And they were often surprised to find that. So they fully expected that their bad things list was going to be longer than their good things list. They were continually surprised to find the opposite was true. They found they were more grateful for more things than they realized. And the bad things appeared to them to be less menacing and threatening in the context of all this good stuff. People told us that they typically forget to do things that are important to them, but with writing things down on the right-hand side, it helped them to remember, and then they got things done, and then they felt good about getting things done. In the interest of time, I'll let you read these quotes on the PowerPoint handout. Also, people found that PPJ, both the left page and the right page, made them feel like they were moving forward in recovery. Based on the left page and seeing all those good things they had listed, someone said it makes you feel much better about life. And the right-hand page, seeing all that she was getting done and making note of all she was doing, made her feel that she could sit in that happiness for a while and be able to just see, I'm starting to get better. There were some critiques. One was that PPJ was repetitive. Some of the gratitude things would be the same day after day, and some of the things to do. But people said this might be because in residential treatment, people are somewhat restricted in what they're able to do. Many said they're not ready to make amends yet. That was true across both studies. Some said there were obstacles to completing PPJ. They were too busy that day, and then they didn't get it done, and then they felt bad about not getting it done. And one person really had a desire to write in more depth. She said, these bullet points serve a purpose, but I want to really get more deeply into it. Fair enough, a critique. A little bit about the second study, the randomized experiment. Again, we'd look at feasibility and acceptability, but with a randomized experiment, we can compare the treatment to the control group and see if PPJ has any effect. And that we can more assuredly say is a result or a cause of PPJ. So in this study, we had the treatment and the control group, so two separate groups. And then we also had a 1-month follow-up. And this took place during COVID. So all our activities took place on Zoom, all took place remotely. So our groups, our recruitment, our follow-up by telephone or Zoom calls. I'm going to skip the poll only in favor of time, Joe. So we're going to have to skip that because I want to wrap up in about 5 minutes to give plenty of time for questions. Interestingly enough, so what did people in the control group do? What they did is they just filled out questionnaires about their mood, how they were doing, and whether they were enacted in any recovery behaviors. But they told us that just filling out the questionnaires, they found to be supportive of their recovery. Now, when you do a randomized control trial, when you become a researcher and you do your first randomized experiment, you don't want the control group to get any benefit from the participation. You want them to hold steady. You want the treatment group to get any benefit. So in this case, the control group told us in the qualitative data, they liked filling out the questionnaires and it helped them and it reinforced their recovery and actually encouraged some recovery behaviors. This means the difference between treatment and control might not be as big as we hypothesize. It might close up because the control group was getting some benefit. And we cared about, in this study, these aspects of well-being, sort of a subset of what we looked at before. So what are some of our results? Well, in the randomized control experiment, they attended about 5 out of 8 of the groups, a little bit less than the single group study. They attended about 68% of group sessions. They submitted 585 PPJ entries, and it was about 15 entries per person on average. I just want to point out that people who did PPJ, they said that they found it more satisfying than the control group, which was just filling out questionnaires. So even though the control group told us that they told us that they enjoyed the questionnaires and it helped them, still the people doing PPJ found it more satisfying, more pleasant. They're in the blue bar, the PPJ bar, the blue bar, and more helpful than the people just filling out the questionnaire. So it did seem to give them a little extra. We also cared about something else in this study. We cared about the exact recovery-related behaviors that PPJ sparked or inspired in people, and whether these led to those elements of well-being. So we asked them, did you write a gratitude list today? Did you reach out to a friend and see how they were doing today? And these questions, we knew that people not in the treatment group might be well doing those things anyway, even without PPJ. We wanted to get a handle on that. So the results I'm going to show you on the next slide. I'm keeping an eye on the time. Joe, I need another half an hour. I know you don't have that for me today, but we'll do our best here. I'm going to show you some results of the randomized experiment in terms of something that's called effect size. Effect size, what effect size is it's the treatment group's average score on something like satisfaction with life minus the control group's score on satisfaction with life. And that's divided by the standard deviation. So these units can be compared to one another. It gives you the effect of the treatment. And a positive effect means that the PPJ group did better. And a negative effect means the PPJ group did worse. or I should say scored lower, scored higher or scored lower. A small effect is 0.2, a medium effect is 0.5, and a large effect is 0.8. Let's look at the effects right away. So what I'm showing you are places where the PPJ journaling did spark or improve or generate more recovery of these recovery behaviors than the control group. I made a list of at least one thing I wanted to do that I'd find pleasurable. I felt able to get things done. I stopped to think over the past day. I wrote down things I wanted to get done in the near future. I wrote a list of things I'm grateful or thankful for. I remembered to do something important. I realized that more good things than bad things were happening, and I realized there's a lot I'm grateful or thankful for. So all these things were an effect of the PPJ journal. Now, of the well-being indicators, there was less of a signal that PPJ was outperforming the control group. PPJ, they seem to have less depression and more satisfaction with life than the control group, and a greater feeling that life is better now in recovery than it was during active addiction. I want to emphasize these results are preliminary. So we're still analyzing the data and nothing has been peer reviewed yet. Again, drop me a note if you want instructions about PPJ that I would email you, or if you're interested in being part of future studies. I would like to do another study of PPJ with a larger sample size, and I'd like to train someone in your organization to start a PPJ group and then have them support them while they start a journaling group at your institution. Those are my ideas for future studies. And if these sound good to you, let me know and let's be in touch about it. Joe, I think in the interest of time, I'm going to stop there. I'm at the end of the presentation of the results. So let's take some questions for the next 10 minutes.
Perfect. Thank you, Amy. And we've got a pile of them. I can see in the chat and throughout, there's been a lot of interest in folks participating. So good there. That's awesome. And we'll get right into the questions. Valerie asked a question earlier on that I didn't get to. Are there any constrictions, I believe I'm reading that, are there any constrictions to expressive writing, like not used in an acute care setting, not used within certain types of trauma or with a particular diagnosis? Any thoughts there?
I believe that that expressive writing research came out before we really knew about the connection between trauma and addiction. So I would like a specialist to, I would personally ask a trauma specialist that question, and I'd be interested in hearing it. Don't forget, there's been very little of expressive writing research with addiction, let alone addiction and trauma. It's an excellent question. It's certainly a cautionary question, and I really want to clear it with someone who's an expert in trauma and, if possible, trauma and addiction before really recommending that practice or how it might be modified to help people who've really had significant trauma.
Great. Thank you, Amy, and thank you for the question. I'm going to dovetail two of them from earlier on when someone asked about writing versus digital. Diani says, I've commented, I've read that writing is more therapeutic as it connects the left and right brain when you're writing. And Denise asked, what about making a tape recording and then listen and write when you feel like it?
You know, the idea of a tape recording is a great idea, especially because our clients might not even have this level of literacy, right? Where we, I work at a university and my life is reading and writing, and my world is reading and writing, but I need to remember that some people who seek addiction treatment don't have the literacy skills, maybe even to do PPJ. So in that case, some kind of audio recording would be a wonderful solution, and I'd love to test that sometime.
Thank you. And you just touched on my next question, which Megan submitted. For people with a low literacy level, especially difficulty writing, do you think people would benefit from just circling the possible responses, or they have to be writing their own entries?
You know, one thing that I think is brilliant about any gratitude list, like if you recommend to a client, write a gratitude list, or maybe many of us have done that ourselves. What's brilliant about the gratitude list is it's so specifically tailored to the individual. So if I tell you that a good thing that happened to me today, or something I'm grateful for, is a lovely walk I took in this lovely weather, there's no one who can argue with me about that. It's absolutely my truth. And it's absolutely specific to me and to my experience. And I think that's where a lot of the power is in a gratitude list, is it's so specifically unique to the person. So that's why I would hesitate about the idea of having things that someone could circle, because I'd want it to really come from them in their own voice, in their own way of saying it. I think I'd be slightly more oriented toward the audio recording idea, or speaking it out in a group session.
Thank you. Thank you for the question, Megan and Amy. Lisa asks, could PPJ be used for problems other than addiction, like depression? And what about individually opposed to in a group?
Very good questions. Let me take them one at a time. I think PPJ is useful for anybody. And when I go on vacation, I take one of these with me, and whoever I'm vacationing with, I sit them down and we do PPJ together, because it's very helpful to know. And then we read out our responses. It's very helpful to know the people sharing my space, sharing my world, what's on their minds, what did they find to be good in the day, and what are their concerns, what didn't work well for them. In a personal social setting, I have people read out the bad things that happened. Again, people only read out what they feel totally safe disclosing, but it's good to know from other people in my world what isn't working for them on that day. So ordinary people, everyday people can use this in ways that feel reinforcing and productive, I feel, is my personal opinion. Now, I'm sorry, I already forgot the second question, but it was a good one.
What about using it individually as opposed to in a group?
Now, my participants, the results aren't completely analyzed yet, but pretty much they liked doing it in a group better than individually. First of all, in a group, that time is set aside to do it, so they get it done. Second, they loved hearing what other people said, and it's super inspiring to hear what other people write, because it gives you ideas to add to your own list. So it can have an extra dimension when it's done in a group than when it's done individually, but it can be done individually as well.
Thank you. Thank you for the question, Lisa. Diane asks, could you share, Amy, your rationale on why things were listed the way they were, the order they were in, and perhaps why they were on the left page versus right page? If you could talk about that a little bit.
Be happy to. So the organization is that in this case, the spiral binding, that seam in the middle of a double page spread, to me represents now the present moment. So that seam, that sort of folded edge in the middle of any book, so in the PPJ book, that seam, in our case, it's a spiral bound black spiral plastic, that represents now. So when people sit down to do this, if it's morning, noon, night, middle of the night, it's always now. And you can always look back at the past 24 hours roughly and plan the upcoming 24 hours, the near future. So it sort of flows along an organization of time, with the past on the left and the future on the right, with a timeline going from left to right. So it has that timeline feel to it. And I like to start with the good things that happened list. So there it is right up front on the upper left-hand side. I think that's a really good place for people to begin to dive into the journal. And as they start that list, what happens is the mind will start firing. The mind is going to think of good things that happened, but the mind is going to fire, oh, I better mail that letter. Then you pop over to the right-hand side and you write that down under home and housing. Then you get back to your good things that happen list. Then the mind will, as you're looking over the past day, you'll think of something bad that happened. You capture it, you pin it down onto the bad things that happen list, and you go back to the good things that happen list until it's completed. So you sort of start there on the upper left-hand side and then flow across left to right, I guess in the way that we read left to right in English.
Thank you, Amy. I really like how you organize that journal, and by the feedback, others do too. It makes a lot of sense. And we have time for one more quick question here. Deidre asked, do you have any plans to expand this type of journaling to support people with severe depression and or anxiety?
I think that's a wonderful idea. I'm all for it. I'm going to start continue to do my work in the addiction field with an addiction focus, but I think there's a great a rationale to do this kind of intervention with people, for example, with depression, because behavioral activation, which largely inspires the right-hand side of the page, was developed to treat depression. It wasn't developed to treat addiction. The application to addiction is only very, very recent. So it's very much in the positive psychology aspect, which is designed to raise positive mood, would be helpful for addiction. I hypothesize also. So I'd love to do that work in the future.
Thank you. And I misspoke, Amy. Do you have time for one more question?
Absolutely.
Thank you. Joanne asks, has PPJ been studied in specific populations such as race and age that resulted in different outcomes, particularly any specific experience in Native American populations?
Thank you for that wonderful question. What we would need to answer those questions is a very large sample size. As of now, the people who I've studied in these two studies, don't forget, one study had 15 people, the other study had 83 people. We had about 30% people who identified as Native American, Indigenous, Black, Hispanic, and other groups. So it hasn't been studied specifically with cultural groups. And our data sets so far are too small to look at different group differences, but you're thinking like a researcher with a wonderful question like that. What you're asking basically is PPJ going to be more effective with certain cultural groups versus other groups? Would PPJ be more effective? Another related question, would PPJ be more effective with people who have longer term sobriety versus brand new sobriety? In other words, for whom not only does PPJ work, does it work, but for whom does it work the best is a very important research question in general.
Thank you, Amy. Thank you, everyone. That is our time for this month. On behalf of the Center for Practice Transformation, we'd like to thank you all for taking the time to join us. And we'd like to extend an extra special thanks to our dear friend and colleague, Dr. Amy Krentzman. Thank you, Amy.
My pleasure, Joe. Anytime.
Please keep an eye out for my email. Please send Amy emails. And for those of you who are going to stick around here, we're going to stop the recording and have a short extended conversation.
Thanks for your comments in the chat.